Hi, my name is Mary Ellen Broersma, and I'm here from Pro Sports Club Physical Therapy, and we're going to demonstrate and talk about some abdominal exercises that are important for back pain patients. This is Evan, and he's going to help demonstrate some of these. So in general, we have 3 layers of abdominal muscles. The rectus abdominis, which is vertical along the front of the chest, or front of the trunk, and it's what we think of when we think of six-pack muscle groups. It's great for helping us sit up. Underneath that rectus abdominis group, we have the obliques, which make an X shape on the trunk. And underneath there, the transverse abdominis muscle group lies horizontal and is the deepest layer of abdominals. The transverse abdominis actually curls around the trunk and attaches to the connective tissue of the back, which is why it's so important when we talk about back pain and preventing back pain and core stabilization. So we're going to go through some exercises to help you learn how to activate your transverse abdominis muscle properly and how to work on some core stabilization exercises to advance that. So Evan, if you could bend your knees for me first here and just place your feet right here, both sides. Good, and the best place to feel the transverse abdominis is just on the inside of our hip bones. So if you could feel just on the inside of your hip bones right here. And Evan, I want you to do a drawing in of your abdominals and tighten that lower part of your abdominals for me. Good, so we can tell he's doing this correctly because it's flattening right across the front of his abdomen here, and he's not holding his breath, and we're not seeing any muscle groups popping up, so we should see a flattening across. So great job with that, Evan. To advance the transverse abdominis isometric contraction, we're going to ask Evan to, again, draw in and tighten his abdominal muscles, and then to march one knee up for me. So he's just going to march this to tabletop and back down. Good, and then let's march the other side up. Great, and back down. What we're looking for here to make sure that Evan has good trunk stability and core stabilization, if we want to call it that, is that his pelvis is not moving at all. So he's checking here with his hands as he lifts. So go ahead and do another rep for me. Lift to one knee up, good. And as he's moving the leg, we should not see any motion here through the trunk. And he's doing a great job of that. Good, so this is one exercise we can do. Some other exercises we can do are what's called bent knee fallouts. So the same requirements here at the trunk. And this time, Evan, you're gonna drop your knee off to the side. Good, and slowly bring that back in. This helps incorporate some rotational components of challenge to the trunk. And as he's rotating again, we're looking to make sure his trunk is stable and still. Good, great job. Let's do one more right here. Even you out, good. And one last one for this basic core stabilization. So again, same rules here. We're gonna do a leg slide. So go ahead, Evan, and straighten your leg out. Good, and slowly bring that leg all the way back to where you started. Nice. And let's do a couple more reps here. Good. So again, we're watching, he's moving his leg while keeping his trunk nice and still. Good. Nice. So to bring the challenge up another level, we're going to do a tabletop exercise. So we're adding on to the march that we did at the beginning. So Evan, again, contracting first, lift this leg up, hold this here, and then holding your abdominals, lift the other leg up to meet. And that's usually where most people will lose their stability. You'll see their pelvis twist right as they try to lift up the second leg. Okay, bring this leg down. Good, and then this leg down. So let's do another rep of that. So contraction first, lift, good, hold stable, lift the other leg, great job, and back down. Good. So after he's good at that exercise, we're gonna do one more addition, and this is where you'll start to see it looks a little bit like some other exercises that you've seen. Good, so tighten in, good, lift here, lift this one up. And so we're gonna add that leg slide component. So straighten this leg out, good, keep that one right there, good, and in, and now straighten this one out. Good. So we can increase the challenge for him by changing all these different leg positions throughout, but the basic components of this is the same. His trunk should be stable as he's moving through these. Good, go ahead and bring your legs back down. Good. Nice job, Evan, thank you. Those are just a few abdominal exercises that you could do to strengthen your core and help prevent back pain. If you have back pain or questions about these exercises, please stop into your local physical therapy office or come see us at Pro Sports Club.